Doctor, thanks very much for joining us. Our topic is Alzheimer's and dementia, the future of the treatment of those diseases. The first question is, why are we seeing what appears to be an explosion in the number of cases of Alzheimer's and dementia?
The frequency of Alzheimer's and dementia increases dramatically as people age. Up to 50% of patients 85 years and older have dementia, and 1 in 8 65 years and older. So as our population ages, it's inevitable that the frequency of the diagnosis will increase. In addition, I think the problems have been more in the news, and as they're become more popularized, more patients and caregivers bring patients seeking a diagnosis. So it's likely the combination of those two factors.
What are the current treatments for these diseases and how well do they work?
There are 5 drugs that are currently approved to treat Alzheimer's disease. Unfortunately, these drugs treat the symptoms of memory loss and don't alter the underlying progression or ultimate course of the disease. But there are a lot of other treatments that can be effective, particularly treatments for vascular disease, alteration in lifestyle that can reduce the risk of vascular disease, can improve brain health overall. So there are treatments in addition to the medications approved for the treatment of Alzheimer's disease.
You mentioned treatments, Doctor. What stands in the way of better, more effective, better outcome treatments than what we have now?
The underlying cause of Alzheimer's is not known at this time. There's been a lot of research, and we certainly know a lot about the underlying processes that result in Alzheimer's, but we don't know the exact cause, and as a result, we can't diagnose Alzheimer's disease in an earlier stage when treatments are likely to be more effective. I think as we learn more about the underlying causes of Alzheimer's disease and develop tests that diagnose people at an earlier stage, then we'll be able to develop treatments that are more effective.
That answer segues into a question about research. What kinds of research are showing the most promise for Alzheimer's and other dementias?
Well, there's a lot of research ongoing, and I think even this week we've seen a lot of publicity about a new national initiative. So some of the most effective possible treatments would be treatments that get at the underlying causes of Alzheimer's. One of those is accumulation of a protein in the brain called beta amyloid, and hopefully as we go into the future we'll develop medications or possibly even immunizations that either prevent or reduce the accumulation of beta amyloid and other factors within the brain that ultimately result in the disease.
How far down the horizon, how far toward the horizon are new drugs or new treatments, things like what you're just talking about?
There are a lot of new drugs that are being researched right now, but all of them are still in the early phases, and unfortunately we're probably talking about a number of years before we develop drugs that are more effective. And part of the reason for that is, as I earlier discussed, we still don't understand entirely what causes Alzheimer's disease. But a lot of research is ongoing, including genetic research. So I think the best researchers in the field are hopeful that over the next 5 to 10 years we'll develop effective drugs to not just treat the symptoms, but treat the underlying causes of Alzheimer's and hopefully prevent its progression.
What's the link between treating high blood pressure, cholesterol, diabetes, other vascular issues, and lowering the risk for Alzheimer's disease?
Most patients that get symptomatic Alzheimer's disease also have vascular damage to the brain, sometimes strokes. So it's the combination of vascular damage and the damage created by Alzheimer's disease that results in many of the symptoms of the disease. And those are things that can be prevented through things, principally a reduction of blood pressure, treatment of high cholesterol when it's present, and simple, very effective drug treatments that we have available today. So there are things we can do to prevent brain damage right now, and that principally includes treatment of vascular disease and reducing the risk of stroke. And that in turn will improve brain health, and even in individuals that develop Alzheimer's disease will lessen the symptoms and delay the course of the overall condition.
As a segue off of that answer, what can we do now to reduce our risk for developing Alzheimer's?
Overall health measures, principally reducing your risk for vascular disease, are probably the most important things to do. And that involves a lot of simple things. It involves weight reduction in patients if they're overweight. It involves going in to see your doctor and getting checkups for conditions like high blood pressure, high cholesterol, and following up with effective treatment for those conditions. And then other overall measures for good general health, including regular exercise, weight maintenance, and maintaining strong social connections are all very important measures that will overall improve anybody's health over the long run and reduce the impact of Alzheimer's disease if at some point it's diagnosed.
Very well. Doctor, thank you very much for your time.
You're welcome. It's been my pleasure.